Good evening. As we're getting deeper into flu season, some hospitals are seeing a surge in emergency room visits. A new report by the Canadian government shows not only are influenza cases on the rise, but more kids are getting hospitalized because of the flu this year.
We're seeing all kinds of cases, especially complications of flu. Kids with pneumonia, with muscle aches that keep them from walking. We've been admitting a lot more kids than usual.
And what effect has that had on the emergency room?
It's definitely made it a lot busier. We're hitting record numbers. In the two departments where I work, we're hitting numbers that we've only seen like at the peak season of flu in previous years.
Public health officials release weekly influenza reports. The most recent on December 15th shows the number of flu cases among young kids and teens more than triple this year compared to 2017. This time last year, there were 384 cases of flu affecting infants 4 years of age and younger. This year, that number has quadrupled to a little over 1,700, while cases in the 5 to 19-year-old category more than doubled, currently standing at nearly 1,650. Overall, hospital emergency rooms are seeing more than 3 times as many kids this year compared to this time last year. In 2017, 27 infants under the age of 1 were hospitalized. This year, that number has more than doubled to 73. In the next age category, the number of cases jumped from 35 to 88 this year. And in the 5 to 9-year-old age category, the number of hospitalized kids more than tripled from 18 to 71.
It can show up in different ways.
This Toronto emergency room physician calls this data alarming, adding that the issue may be low rates of vaccination.
The parents that I talk to, hardly any of them are vaccinated or their children are not vaccinated. I think there was an issue where we're relying more on pharmacies to deliver the flu vaccine, and pharmacies can't vaccinate children below 5 or 2 in some cases, and the pediatricians' offices weren't fully stocked.
In your 10 years of practicing medicine, have you ever seen this amount of young kids visiting the emergency room because of the flu?
I think this is probably one of the worst years.
Do you think that hospitalizations could be avoided if someone is vaccinated?
Definitely. I think there's a lot of myths regarding the flu vaccine. Definitely the flu vaccine cannot cause you to have flu. That is a myth. Kids and elderly and people with medical conditions are always more vulnerable to the effects of flu. Their immune systems aren't as strong.
At what point should people go to the hospital?
They should go if they're basically if they're having trouble breathing, if they're not eating or drinking, if they're confused, dizzy, severe chest pain. Generally, if they're unsure as well, they don't have the expertise, it's always best to get checked if you're not sure.
As we go into the next few months, do you expect this number to improve at all?
I hope so. I hope we've hit the peak this week, in the next few weeks. But, I know that on the administration level, the hospitals have been making a lot of preparations by opening up beds and things like that to prepare for a worse season as well.
We've been telling you about the strain being placed on emergency rooms during the flu season and how a recent government report states more kids are getting hospitalized with the flu. Now, you mix that with the fact that during the holiday seasons, most healthcare facilities are either closed or working on reduced hours, which means it may take you a long time to see a doctor. But an entrepreneur says his new app, the Canada-wide app called Holiday Hours, can fill in that missing gap, connecting patients with hospitals during the stressful holiday season.
With the stress of a holiday season, it's hard to know what's open and what's available, and so a lot of people would rely on emergency rooms. And so from my perspective, I see an opportunity to leverage information and how to make that information readily available to patients so that they know immediately what's available when they need it, even on, say, Christmas Day or New Year's Day. Just go to the website on your phone or computer, enter in the location, whether it's an address, postal code. You can even enter in like CN Tower or Nathan Phillips Square and select what you're looking for. And on a map, it'll show you all your options, from hospitals to walk-in clinics to pharmacies, even family doctor offices. They've spoken to a number of doctors, as well as people in the public sector, in the government, and a lot of them say that this fills a need. Just having real-time information or knowing what's available in your community right now when you need it is very useful for pretty much everyone in the healthcare system, from staff to doctors to patients.
Now, this is a year-round app and can be used anytime. It also provides additional administrative support to doctors, meaning their patients can actually log on to this app and book their own appointments.